Hi everybody. So I've been doing more of my learning, so here I am sharing my nuggets again. Um, just did a really interesting CPD, more based from a behaviourist perspective, from the pain situation, and it was really interesting. We heard a few more nuggets. So they do. I mean, we've known for a long time that they believe that 80% of behavioural issues are likely to be pain related. So we're aware of that already. But what was interesting was more thinking about it from the fear of pain perspective. So we know obviously that pain causes behaviour changes that will make them avoid causing the pain. But you never really think about the word fear because they're doing that because they fear the pain that comes. And the interesting bit to then sort of lead that to was, what do humans do when we have fear issues? If we have crazy high, because obviously fear is something that varies immensely for all people, obviously, and it does for dogs. I mean, some dogs will fear, I don't know, a white stone on the side of the road. Other dogs fear very sensible things like, I don't know, jumping out of a moving car. And then meanwhile, other dogs will just jump out of moving cars. So they have all sorts of complex emotions just like we do. But if we have fear that's unreasonable, and this does work in the pain situation because humans do pain clinics, um, then they have to work on their fear by way of talking therapy. So usually it's like cognitive behavioural therapy, stuff that involves talking about it, desensitizing themselves, stuff like that. So obviously the word desensitizing is one that you could probably be triggered with from a behaviourist point of view because behaviourists do work with desensitizing animals from their situations and their worries and concerns, and that's part of their training situation. But really, it just backed up the fact that we do have to remember that we are part of a team, and it may be that part of that team is the behaviourist, which is an amazing part of that team. And then remember, there's a two-way street on that. You know, sometimes a behaviourist sends a patient to me because of pain, which is absolutely fantastic and absolutely the right thing to do. But sometimes with chronic pain, we can't necessarily fix that pain and make it go away completely, ready for the training to begin. So sometimes it's an overlap, and we have to help the dog learn to just live with that pain. And let's use the word discomfort rather than pain, because obviously when it's pain, we are obviously treating it, and we may need more and more meds, all just part of that multimodal approach, trying to make sure we're getting the right approach and the right cover of pain relief. But it is quite inevitable that obviously the more that the patient progresses and the disease progresses, then obviously, it takes more and more interventions to be able to resolve that discomfort. So it was just backing up multimodal team, multimodal approach, lots of people in a team, and just keeping your eyes peeled for any concerns of fear or any of those other sort of emotional issues that are going with those pain problems. Hope that helps. See you later. Bye bye.